Any person may speak about any subject of concern provided it is within the jurisdiction of the Board of Supervisors and is not already on today's agenda. The total amount of time allotted for receiving such public communication should be limited to a total of 15 minutes, and each individual or group will be limited to no more than 3 minutes. Prior to this time, speakers are requested to fill out a request to speak card and submit it to the clerk of the Board of Supervisors. If you are participating via Zoom and wish to comment, please use the raise hand function or *9 if participating on a phone. Please note, no board action can be taken on comments made under this heading. Through the chair, I have 3 cards. Ms. Karen Liggett.
Good morning, board.
Good morning.
I'm here about the food bank. I'm really still concerned about the area's health as far as the fellowship involvement. I was looking at the pictures of the victims outside. There's no pictures of the 6 victims that OD'd because of the fellowship doctor years ago. I'm in mourning for them. They need justice because it was never said if they purposely was killed or it was just an accident. So those people need a memory of being a victim of the fellowship, as well as the illegal pot grows that the fellowship has done for years and never got caught. And as well as the soil not being tested where they wanted to grow their crops to be selling. So that I hope Yuba County has their best interest for the public to test the soil that they're going to be wanting to grow anything if and when, hopefully not ever, that you guys let the fellowship do anything for the community and give the acceptance, because with their criminal history of sexual abuse on kids and everything else, they're not acceptable as good role models to do anything for Yuba County. They're all about themselves, trying to make money. They're doing crime after crime. They've never been caught and arrested. None of them, including Robert Burton that runs the fellowship. He's never been arrested for molesting kids and raping them. So enough is enough. The fellowship needs to be held accountable. So please say no to the food hub for the security and the safety, because they could overdose or kill community members that don't agree with them. Thank you.
Great, thanks.
Mr. Tom McWhorter.
Morning.
Good morning.
Supervisors. How are you today?
Good.
Well, my comments here are going to be concerning the election integrity. So basically, we have a elections clerk who has said that my experience matters, but Yuba County voters here, status quo is fine. The county clerk says she's not a politician. But the county voters here, I am a political appointee and a bureaucrat. The county clerk says that she has been here for 17 years in the department. Yuba County voters here that I have been here too long. Don Hillegas also has stated that, and I've even witnessed it when she made this comments, that she's overseen 30 elections. Yuba County voters here that I am overseeing my election. Donna Hillegas stated that she manages a budget of $2 million and a staff of 14. Yuba County voters here, my office has a bloated budget and is overstaffed. Donna Hillegas states that she is committed to election integrity. Yuba County voters here, I will keep things the way they are. Having received campaign information regarding our current county clerk, I felt that I had to put this out, in that she herself has stated that among our county members that there's a growing distrust in the current election system. but she remains committed to the current process. With nearly 30 years in government and 17 years as a deputy clerk, there is still growing distrust in Yuba County by our own admission. So I would just like to say, I understand that supposedly there is no rule stating that she has to recuse herself from overseeing the election. It might not be a bad idea just to do it as a new leaf version 2.0 instead of how we've done it for centuries in order to increase the trust in our election system. How about we try something new, such as recusing the county clerk because she's running for that office. And as we've stated in the past already, judges don't recuse themselves from cases because they're going to cheat or lie or steal. They do it to avoid any possibility of anybody having the ability to appeal the outcome of the case that they try. So anyway, I would just like to say, hope everybody's doing fine. And I noticed the can that Seth, that's not a White Claw, right? So anyway, have a nice week and thank you very much for your time.
Thank you.
Mr. Charles Sharp.
Good morning. Hello. Yes, you can hear me. Good morning, Charles Sharp, Oregon House. I want to thank the county for the grading efforts you're making for some of the roads in Oregon House, Browns Valley, and Loma Rica. Today, I come not to praise Caesar, but to give him some trouble. The lack of any section on the North Yuba Water District in the county's hazard mitigation report is either a huge oversight or an intentional omission. Either way, the county is inept or someone is corrupt. Very troubling in either case. About 2 years ago, after jurors attended several board meetings at the water district, the Yuba County grand jury abruptly dropped its investigation of the water district, almost as if someone didn't want attention to be drawn to the district. Another anomaly has recently come to light regarding the division map adopted 2 years ago. The population counts for the 5 divisions range from 732 to 738. This is a very precise map making to so evenly divide 3,675 people. Contrast this to the voter registrations, which range from a mere 170 voters in Division 2 to a whopping 791 in Division 5. This is a correction. I believe in the letter it said Division 4. Here's the voter list for you to look at. You can count for yourselves. There you go. As you may recall, the map caused a lot of trouble for Yuba-Sutter. The water district is now involved in 6 active lawsuits and cannot nor will not deliver water to its customers. Gentlemen, although the world will little note nor long remember what I may say here, nevertheless, I hope the Board of Supervisors will soon weigh in on this troubled water district and express an official opinion regarding all the controversy surrounding this special district. Like some acid, everything this water district touches, it brings a corrosive element to in Yuba County, particularly the elections department, the GIS department, Yuba-Lafco, and probably maybe even the grand jury. Your silence is effectively supporting this wayward water district in the foothills of Yuba County. So thank you very much for your time.
Thank you.
For the cards, and it doesn't appear anyone on Zoom is requesting to speak.
Okay, moving right along to county departments, 2023-2022, adopt resolution approving the 2022 to 25 work plan for Yuba County Tobacco Control Education Program.
Good morning, Chair. Good morning,
Good
members
morning.
of the board. Thank you so much for having me today. My name is Adam Vaughn. I'm the nursing manager representing Health and Human Services today. And I'm here to go ahead and ask you guys if you could approve our 2022 to 2025 tobacco education program work plan, as well as the resolution that would authorize our Health and Human Services director to accept allocation funds, also to be able to authorize also execute the annual acceptance of allocation agreements, as well as pertinent documents related to the program. To give you some background, this program, the Tobacco Education Program, focuses on education and preventing tobacco use. It's really important, especially in this community, because we have a lot of long-term smokers here that state that they started when they were teens and young adults. And we know that young adults and adolescents, when exposed to nicotine, it can harm the development of their brain, and it can also predispose them to future tobacco use. According to the California Department of Public Health's status report on our county, Yuba County adults are smoking at a higher rate than California overall. And as well as that, we look at death rates here in Yuba County, and we see that smoking is a contributing factor to things such as heart disease, strokes, many different types of cancer and respiratory chronic diseases. And in all of those areas, Yuba County has higher deaths than the state for those areas, as well as we have more adults smoking here in Yuba County versus California. We also learned from the California Healthy Kids Survey that our youth are smoking e-cigarettes and vaping at a higher rate here than they are in California overall. We're really concerned about that. So Yuba County has been allocated $1,050,000 for the years 22 to 25, and from the state in order to perform very specific required activities of this program's grant. Each of these activities are state assigned requirements, and they're focused on providing educational activities, keeping tobacco out of the hands of our youth, and helping tobacco users quit. The program will utilize social media, paid media campaigns, collaboration with community stakeholders, participation in community outreach events and education events, and also gain public input to better understand the community's attitudes and knowledge about tobacco-related issues. So we're asking today that that because of how adversely affected Yuba County is related to tobacco use, that on behalf of Health and Human Services, I'm asking that the board approve the work plan to adopt the resolution. And I really appreciate your guys' time. And if you have any questions, please let me know.
Questions from the board?
Through the chair. Adam, is there any way that we can also address the marijuana, include that, because it's similar in use as far as smoking?
Yes, I absolutely appreciate that comment. And while I recognize that is an issue in this area, this grant is very specific to no other substances besides tobacco. And we can always look at other ways that we can address that.
Okay. And one other question.
Sure.
You say there's a greater per capita death rate by smoking. Does it go into researching whether they're smoking other substances such as meth and, or using other substances?
That's
as far as the deaths go.
Yeah, that's a really great question. There are some statistics that we do collect, but at this point, I can't tell you if there's other contributing factors or other contributing substances, but that is something that we can look into, trying to see if we can collect those statistics and return that to the board. Is that something that we can go forward today without, or would you like me to return with more statistics related to that?
I would like to find out. It's like COVID. Did you die of COVID or with COVID? Okay. Same situation. Because if you have somebody using meth, then that should not, tobacco should not be the primary cause. debt.
Right. And we do, it is a contributing cause, but you're absolutely right. There may be other contributing causes.
Do we need to move forward on this particular thing so we get $1 million in grant money currently?
Yes.
Okay, so I think that we can have him come back and report about that particular
That's
issue,
fine.
But
Yeah.
I go ahead and move that we approve this as is so that we can get that grant money.
I'll second, and then through the chair, I have a quick question as well. So I'm happy to hear that one aspect of the program will be outreach via social media. Do you know if there's also a plan to put all the great materials that will be developed like on a website where they'll be accessible for folks in the community that might want to use them? And if that's not part of the plan, that's okay, but maybe it's something that could be considered.
I really appreciate that. And we'll actually take that into consideration because I think anytime we can make our work meaningful, impactful to the community is important to us as well.
Okay, thank you.
Thank you.
So Adam, help me understand the difference between tobacco, whether it's a tobacco leaf or a marijuana leaf. When you say that's not really designated for this program, if it smokes, if it creates a product that you inhale that can infect your lungs, not necessarily from a drug, however, tobacco does a very similar, exactly what is that difference that we're talking about?
Absolutely understand that question. Well, yes, both are combustibles that one is inhaling and can cause that similar damage. And so definitely something that is a priority to address as well. But unfortunately, with this funding, we are unable to address that here. This is because the state has a very narrow scope in what we can address with this funding. But I am definitely open to other considerations to be able to address marijuana smoking and other things in the future if we have those opportunities to present to the board.
So within this grant, it specifically excludes marijuana, is that correct?
I think I would have to double check with that, but I do not believe it covers any marijuana use related to this right now. This is tobacco, very narrowly tobacco focused grant.
And I can help add to that.
Right.
Way back when I was much younger, there was litigation filed.
Just the other day.
Just the other
couple days ago.
There was litigation filed by states' attorney generals against tobacco companies. It was a national lawsuit. As a result of that lawsuit, a settlement was entered into. The monies paid by the manufacturers by way of the settlement agreement had to be used for tobacco related matters. And the state, after that settlement, then adopted their program to comply with that settlement agreement. So it's not, it wasn't just the legislature coming up with this program. It was really the result of that tobacco lawsuit. So in order to comply with that settlement agreement, which is overseen by the federal courts, the state had to limit how these funds could be used.
And that was identified in that settlement.
Yeah. Yes. Yeah. You'll see something very similar with the opioid lawsuits, that the multitude of those that have been filed when the monies flow into the state.
Okay.
Eliminate smoking, including burning or heating of tobacco and other plant products, natural or synthetic, and all outdoor recreational. That would pretty well cover that. Just adding tobacco and other plant products would work.
Yes, I do see that in an objective that is related to. I think Jennifer Vasquez, our director here, could speak to that.
Yeah, so as Mike mentioned, this is really specific to tobacco, but I'm hearing the feedback from the board, and we do have other funding opportunities. So if we wanted to focus some of our efforts on marijuana, we could include that. So for example, if we're doing an outreach event where we're trying to promote people not using tobacco products, we could also promote and provide education on the impacts of marijuana use as well. So this is really around promotion to help people know that there's available resources to quit smoking, and then education on the harmful effects. So I think there's a way for us to tie in marijuana as well. And we can go back and look at the scope of work, and we're really hearing, I think Adam and I are hearing your feedback and making sure that we're including those educational topics as well, even if it's not with this particular funding that's focused on tobacco, as Mike mentioned.
Thank you very much.
Very good. Any comments from the public? Back to the board. We have a first and a second. All in favor signify by saying aye. Aye. Opposed? That passes. And council, if you would dig into that to the maximum depth of the flexibility, that would be greatly appreciated.
I will be happy to pull up the settlement agreement.
That'd be wonderful.
Thank you so much, board.
Thank you. Item number 232, 2022, adopt resolution amending classification system basic salary hourly schedule as relates to accounting, animal care, and public works maintenance job series.
Good morning, Chairman, members of the board. I'm Jill Abel with the Human Resources Department. This morning, I'm asking your board to approve a resolution and amending the classification schedule for 3 particular job series. When we did our contract negotiations last year with our Yuba County Employees Association, we agreed to do some studies of specific series, specifically the accounting series and the animal care series, because we knew that we had some recruitment and retention issues there. However, those issues got even worse recently, to the point that we then also needed to add another series, which was the Public Works Road Maintenance Worker series. We were in a situation where, despite all of the advertising, despite all of the ways to try to recruit people and retain people, and even look at creative ways to make positions open until filled, and eliminate some of the barriers in the pre-employment process, we were unable to fill positions, to the point that some of these classifications had a 40 to 60% vacancy rate. This was really debilitating for departments. They did not have the ability to do what they needed to do to serve the public. And so we brought to the county administrator this issue. We had a recommendation, and that is where this comes from today. We were asking that your board approve increases to these classifications as outlined in the staff report, but that these classifications be, or that these increases go into effect on May 1st, so that we can try our very hardest to fill these vacancies. We've got some critical needs in departments, including public works, where at 50 to 40% staffing, or 40 to 50% staffing, they're not able to service the roads. That's a really big deal. So we'd like to do this on May 1st. The cost of these increases are covered by salary savings this fiscal year, because departments have vacant positions. And then the cost for next fiscal year would be covered in their budget. Are there any questions from the board?
Questions? Questions from the public?
So moved.
I'll second.
I have a first and a second. All in favor signify by saying aye.
Aye.
Aye. Opposed?
Thank you very much.
Thank you. Item number 221, 2022. Receive and approve annual update for the Mental Health Services Act for fiscal year 2020 and 2021.
Good morning, Chair and Board.
Good morning.
Happy to be here with you today. My name is Mark Schlutzmeyer. I'm the Branch Director for Adult Services for Sutter County, also with Sutter Yuba Behavioral Health. And I'm here today to request your approval for the fiscal year 2021 Mental Health Services Act annual update. And I'll talk just a little bit about the Mental Health Services Act, how we developed this annual update, and sort of the process by which we got community input into the annual update that we're requesting approval for today. So you'll notice that it's a fiscal year 2021 update, which you're probably wondering, why is it 2021 when here we are in 2022? And the reason for that is that during COVID, we had some pretty significant delays in terms of the reporting that we were able to do to the state, and the state gave us the ability to delay our annual updates. So we did that. We also at that time had a change in terms of our Mental Health Services Act coordinator position. We have a new Mental Health Services Act coordinator, Betsy Gowan, who's was shifting into her position right at the time when these annual updates were being done. So the combination of those two things put us a little bit behind the curve in terms of getting our annual update put out. But this is what we've worked on for the last several months over at Behavioral Health. We have engaged in a community stakeholder process, which is required by the Mental Health Services Act. Essentially what we do is we hold community forums where we invite community members to review our annual update, provide input into the process, and give us feedback about the services that we offer or that we describe in our updates. So we had three specific community planning sessions that were held regarding this annual update. One which was held in English, one which was held in English and Spanish, and then one which was held in English and Hmong. And we had a total of 133 community members participating in our stakeholder process to provide us input that went into the process of developing the update. We have, so this update, because it reflects 2021, it doesn't have a lot of information about newer programs that we're focusing on in the coming year, but I'd be happy to answer any questions about either the 2021 update or about upcoming changes in Mental Health Services Act services that are being provided in the coming year or two. So happy to answer any questions that you might have about the request.
Questions from the board?
Through the chair. How do you determine eligibility for mental health services? Is there a guideline somewhere?
Yeah, so the way the state provides what's called a split benefit, which means that individuals who are in need of mental health services, assuming that they are receiving if they're Medi-Cal recipients, they are divided between either mild to moderate mental health conditions or chronic and severe mental health conditions. At Sutter Yuba Behavioral Health, we provide what's called specialty mental health services, which focus on chronic and severe mental health conditions. Folks who have mild or moderate mental health conditions receive services through the managed care plans, Anthem, which in our area are Anthem Blue Cross and California Health and Wellness. So there's a triage process that has to happen for folks who are seeking services. Typically, people come into our clinic as a walk-in. We have an open access clinic where people just walk in. They say, hey, I need behavioral health services. I need substance use services. And we sit down. It's on a walk-in basis. So we either sit down with them or we do a phone triage with them and talk to them about what's going on to determine what their mental health needs are. And then we make recommendations from there, set them up with a clinician, a therapist, or a psychiatrist to help them get medications and things like that. If the person turns out to be more in that mild to moderate range, then we work with the managed care plan to then connect the person to services through Anthem Blue Cross or through California Health and Wellness. Many of our clinics in town serve the Medi-Cal population. Peachtree Clinic, Harmony Health here, and Ampla Health all serve the mild to moderate population.
So who determines that the homeless population, who evaluates the homeless population, determines that they require
their eligibility for services?
Yes.
Yeah, so that's a great question. We have, so just in the last year, a little over a year, we've Behavioral Health has started a new team called the Homeless Engagement and Resolution Team, which, or the HEART team, we call it. The HEART team goes out with law enforcement and does a lot of outreach and engagement with the homeless population. They don't necessarily conduct a mental health triage with that person out there in the field, but what they do is they help if there's a homeless individual that needs mental health services or substance use services, they evaluate the situation, try to make treatment recommendations, encourage the folks to come into treatment. We also have another program called the PATH program, which provides outreach to people once they've been identified. If a person is homeless and they have a chronic or severe mental illness, the PATH program can engage them on an ongoing basis, work with them on getting housed and also on getting treatment.
Okay. One other question, drug and alcohol abuse, which some people blame for the mental illness. What are we doing to try and help them get off the drugs and the alcohol? Or do we require testing, or is there some way of, because it seems like an endless cycle?
Right. Yeah, that's a good question. So Supervisor Blazer attends a meeting actually with us often called the Creating Safe and Informed Communities Committee. And we talk in that meeting about what are we doing to try and basically provide resources to help people who are wanting to get off the street, wanting to get clean and sober into treatment as soon as possible. One of the things that we found in the meetings is that we have law enforcement folks who are out there on the street building these relationships with community members who are homeless. And we find that for many folks, they're sort of resistant to treatment for a while, right? They may resist. They're not ready to change. They're not ready to get help. And then they reach a little point where they say, a window where they feel enough trust with our teams. They have maybe they kind of hit a rock bottom point or something like that in their lives. And they have this little window where they're willing to accept help. And the struggle that we've had in the past has been that because there's such a limited amount of shelter beds, it's hard for us to really strike while the iron is hot and get that person off the street and get them into treatment. We're right now in the process, actually this week on Monday of last week, we just started a new process that we call a project called Start to Finish. And what Start to Finish is it's a project where we have a couple of beds in a shelter where we're able to, at 14 Forward, we're able to have the HEART team put people in those beds right away, get them right off the street into the shelter, and then get them right into treatment. So that's one example. We're constantly talking about ideas for how to really get treatment services tailored to folks who are homeless in a more streamlined way. Of course, because the services are voluntary, we can't force people to go into treatment programs. But this program that we call Start to Finish, it really gives us a way to kind of streamline. As soon as somebody says, I want help, we can put them in the shelter. We can get them from the shelter into a treatment program and then get them some follow-up care afterwards.
Can't you condition treatment on their effort to stop the destructive behavior?
I guess I don't understand the condition. What do you mean condition treatment on?
If they're into meth or they're into alcohol, or they continue to use, and they're going to continue to be until they make that choice to stop. Can't we condition treatment on their willingness to try and stop?
Well, I guess what I'm saying is that for some folks, if they're using drugs and alcohol, if there's no, I guess what I'm saying, we can offer a lot of carrots. We can sort of say like, hey, there's a lot of benefits to you getting off of drugs and alcohol. There's a lot of benefits to you getting into treatment, but we don't necessarily have this, unless the person's involved in the legal system, there's not always the stick part where you can sort of say, you must get this treatment. Okay. I guess and maybe I'm missing the question.
Having been in on the behavioral health committee once for about 5 years, it seems to be a revolving door.
Right.
It's like be nice. It's like the no bail situation now, but I just don't see it being that effective without that commitment on their part to do something about the situation they're in. So that's my personal feeling. It's a revolving door, and the actual numbers that we help are relatively insignificant in comparison.
Yeah, we do. We do find that when the HEART team goes out, the HEART team can provide better stats about this. But they did, for example, they did a recent outreach in Sutter County. I believe they cleaned out, I think, 24 or 25 camps. And they had, I think, 2 people out of the 25 that said, yes, we want help. Yes, we want shelter. Yes, we want treatment. And so, it's about 10%, less than 10% of folks that are getting removed from their campsite are going to say, yeah, I want the help. Most of them will just say, that's all right. I'll find another place to stay. I'll move on down the river. I'll go somewhere else. So we know that, but what we're trying to focus on is, well, what are we doing with those two people, those 10%? Do we have a service that we can really offer them to help them when they say, yeah, I want the help? And at this point, that's what we have to focus on, right? Because we can't force the other 23 people to get help. All we can do is help the 2 that say, yeah, get me off the street, get me off the river, get me into the shelter, get me into treatment. So we're really streamlining that process to get those 10% into treatment so that we can, help them one at a time.
All right, I've had a number of people call me and they sit there and watch their kids destroy themselves with meth or other things. Is there any number that they can call to hopefully reach out to someone who might offer a solution to these parents that have no?
Yeah, I would direct them to the coordinated entry system. So I don't have it right off. Maybe somebody can provide the number for the Life Building Center. Really, that's probably the best place for folks to start. We also, in both Sutter and Yuba counties, have a homeless.
Do we have any kind of a pamphlet or, something that we can give them?
Yeah, there's information cards that the Life Building Center and Hands of Hope have that they can hand out that has the information about, the different services that are offered to homeless individuals, how to get connected, and the phone number.
Okay, thank you.
Through the chair. 2-part question. One is maybe you could highlight that declining service population a little more.
Mm-hmm.
Yeah, everything I hear, it's 90% of the encounters are declining service.
Right.
A fair number, I guess. And then secondly, can you tell us how serious the shortage of therapists are?
Yeah, so the first issue, the declining services population. So this is a conversation we've kind of developed in the Creating Safe and Informed Communities Committee. We've found that in getting feedback from law enforcement partners that there's like Supervisor Blazer said, about 90% or so, sometimes more, of the folks that we reach out to offer them either housing, shelter, services, connection to coordinated entry. A majority of those folks decline the services, and we've really talked about figuring out, well, why is that? What are the issues that the homeless public has that's causing this decline of services? And there's been 3 kind of core things that we've recognized. One is building relationships of trust, that most of the folks report that they don't trust the system for whatever reason. Many of them have been to, tried to get services and had there's either stigma issues, there's some barriers that come up with them, or the people that they've reached out to for help aren't able to provide help right away. So they don't trust that the help is going to be there for them. A second one is access to substance use services. So we identified as a committee that really the ability to quickly and immediately access substance use treatment was a barrier for a lot of folks to getting help. So that's another one that we focused on. And the third one was what we call a start to finish approach, which is there's so many cracks in the system that we have that when a person says, hey, I want help, we don't always have all of those cracks sealed up so that the person can get right off the street, right into the shelter, right into treatment, get the full spectrum of services. So we've been taking a few different approaches to trying to address that last one and creating what we're calling start to finish kind of approach where people can get all the way off the street. So that the declining services population is essentially those folks that say, no, thanks, I don't want help. We need to create a better system for, making it so that those folks can get help when they're ready. The second question about therapist shortages. So we have had a pretty long-standing therapist shortage at behavioral health. Probably, I'd say we have not been fully staffed with therapists for at least 2 years. So it's since before COVID that we've been fully staffed. So we've struggled with that. We're spending a lot of time and energy trying to focus on recruitment, we're now actually behavioral health is working on a contract currently for telehealth to bring on some teletherapists to help with those shortages. We also have, fortunately, hired 2 new therapists on the adult side just recently. So that's helping us a little bit. But we always struggle with therapist shortage at this time. It's actually a statewide issue for county systems. We just struggle with holding therapists. There's a lot of opportunity right now for therapists. I get an email probably every day, just about every day or every other day, trying to be recruited as a telehealth therapist here or there, once they get your email address there. So there's just lots of opportunity right now for mental health therapists in our state. So we have to compete with Kaiser and compete with other private entities for these therapists.
So is it fair to say that the population we see on the street that residents are complaining about, the odds are pretty good. They're pretty much all declining service population.
There's probably pretty good odds that many of those folks have been approached. So we feel like we're at a point now where many of the folks that we see have been offered services and have declined. However, we also know that there's a lot of new folks coming through coordinated entry continuously. So we see that on average, coordinated entry has about between like 80 and 120 new homeless individuals that are being intaked every month. I mean, think about that. That's a pretty big number. So there's a lot of new intakes that they're doing month to month. So it's not that nobody's accepting services. People are going to coordinated entry and they are getting a vulnerability index completed. It's just they may not have a lot of services to be offered, or they may be maybe they've taken advantage of the services that they were offered and they're just waiting for shelter. Some folks, we have pretty big shelter wait lists in this area.
Okay, last question. Coordinated entry, are they going to expand their hours?
That's a good question, and I don't know the answer to. I don't know if there's been discussion recently about coordinated entry expansion of hours.
Currently,
but we can find out.
5 days a week.
I believe so. I believe at both sites they're operating 5 days a week now.
All right, thanks.
Thank you. I guess my question is about allocation of funds. As we talked about recently, we need more therapists. We need more drug rehab programs. I commend what we've done with New Haven and with Cedar Lane, and that we're going to provide, I think, 20 to 30 beds.
It'll be, a total of 40 units at Cedar Lane. 19 of those will be behavioral health specific, and then 20 will be just the general homeless population. Yeah.
So more behavioral health specific beds, I think, is really absolutely what we need. If a third of the homeless are behavioral health issues, that's 300 behavioral health cases that need help, chronic and severe category. And so I'd like to see our funds go there. So when I looked through the list of things that we were putting money into, I noticed that we're doing classes in high schools for gender identity and for gender orientation or sexual orientation. I'm curious, would that money be spent better going towards all of the services we were just discussing?
Yeah. So in addition to the groups that are mentioned in the plan there for high schoolers, there's also funding for an additional homeless member of the HEART team that provides intervention. It's an intervention counselor that provides substance use services specifically. So in our new, it's not described in the 2021 update but it is mentioned in your staff report because it is something that we're looking that we've already submitted it into the budget and it's approved for the coming fiscal year.
So for the coming year, are we going to be doing more gender identity classes, or are we going to spend that money on helping homeless get off the street?
Both. So we're not taking from one, and the groups that are mentioned in there for the PEI program are not just about gender identity. There's like 5 different topics that they're covering in those groups. That is one of the topics. But so in addition to prevention and early intervention dollars being spent on those group activities in the high schools, there's also prevention and early intervention money being spent on homeless outreach activities.
So if I wanted us to move the money from those activities to really working on safety security for people.
So cancel out the groups?
The ones that are questionable. I guess it's a matter of how much value we're getting bang for buck, right? Okay. And I'm not sure that the significant cause of people being homeless and having mental schizophrenic, needing drugs to deal with chemicals in the brain is related to something that's solvable by having a gender identity class in high school. And so I'm thinking less of that and more of beds for people who are mentally impaired would be a better use of the money.
Yeah. So I guess what I would say is that, you know, the mission that Sutter Yuba Behavioral Health has is a pretty broad one. So we have to cover a lot of different areas. So when it comes to prevention and early intervention dollars, there's some of that money that we can spend on adults and homeless needs and things like that. But then we also have a mandate to spend a certain amount of that on youth and outreach to youth. And I don't know off the top of my head because I'm not the MHSA coordinator and she's out sick. But I believe it's at least 50% of that money has to be spent on youth. And so that does put us in a little bit of a bind in terms of if we just take money from the youth services, like the high school education programs, and then move those over to adult programs, then
I'm all in favor of spending money in homeless prevention or in assistance and mental care for youth.
Sure.
I've had situations where I've brought youth to mental health and they've been turned away for services because either they were determined to not be severe enough. That person then later had a catatonic complete meltdown and was in a near hospitable state. I've had other people I've brought to mental health and they said, well, they're not suiciding right now. They're not 5150 right this second. So we're going to go ahead and send them away. And that's problematic to me. So I'm totally in favor of us having services for youth. I just don't know where we're going to channel that money in services for youth. The question is about the gender identity class and sexual orientation class. That doesn't seem to be a useful place to be putting the money to prevent youth from suicide, to prevent youth from engaging in drug use, to prevent youth from that have actual chemical imbalances that need specialized and intensive intervention.
Okay, so that's a different topic then. So what you're saying is that rather than not taking money from the youth programs such as the high school groups and moving it over to homeless adult programs, but within the groups that are being offered to youth, taking some of those groups that are focused on gender identity and sexual orientation issues, moving those groups or eliminating those groups and focusing more of those resources on things like suicide prevention or other things like that. Is that what you're saying? Yeah. So that's something, I mean, if the board wants to hold off on approving our annual update for now, that's fine. This particular update is retroactive, meaning that it's talking specifically about things that happened in 2021, not necessarily things that are happening in the coming year. But so what we could do if the board agrees to it is we could approve the 2021 update, but incorporate kind of the suggestions that you're making into the future establishment of these groups that are kind of moving forward.
Awesome. So I would move that we approve 2021 and we make those changes for 2022.
Okay. Any other questions or requests?
Additional comments from the board? Before we go to the motion, two more really quick questions and we'll wrap this up. Sounds to me like this board needs to be more active at the meetings, which could be very valuable, and there's no reason you can't attend those meetings. So I might keep that in mind, and I like that. Of that 90%, are we in the norm throughout the state? Is that typical throughout the state of California that are turning things down?
That are declining services? I imagine it probably depends on the county and the area. And the types of services that people are being offered. I don't have statistics that I could readily report to the board, but be happy to look into that and see if there's other jurisdictions that have attempted to measure this. You know, we've specifically focused on it because I feel that Sutter and Yuba counties are kind of at a sort of, I mean, we're farther along than a lot of other areas in terms of the amount of outreach that we're doing to the homeless population. So I don't know that there's, that I might not be able to find a lot of statistics about the declining services population. And it's actually that phrase, that term declining services population is something that we developed ourselves, just because we've noticed that this is kind of the issue for us, that we're doing lots and lots of outreach, making lots of frequent contacts with the homeless population, and just continuously hearing this, no thanks, I'm not interested thing, despite the fact that we're offering lots of services. We're pretty service heavy actually in this county compared to other places in terms of what we offer through coordinated entry, the amount of support. We are low though on shelter beds. We are low on affordable housing. We know that, right? We know that we don't have a lot of affordable housing units that are just out there ready for people to walk into and rent. So those are the areas that we struggle in. A lot of folks that are out there, they want the housing, they want a place to live, but they don't necessarily want to come through coordinated entry again. And that's what we're trying to figure out. Well, what is it? Why is it that they're saying, no, I don't need your help? And those three top kind of areas that I identified earlier are the reasons that we've gathered. That it's the lack of trust, the lack of quick and easy access to substance use services when a person is ready for it, and then the lack of sort of a start to finish kind of approach. So we've worked on sealing up those cracks.
In other words, they don't want to interrupt their enjoyment of recreational drugs.
So my point of the question on this is really, if we're similar to everyone else and we're all doing about the same thing, but if you were to find a county or a community that only had a 10%, what are they doing different than we're doing? And whether they keep statistics on that or not, I don't know. But if they were, and you found that county, it could be interesting to find out what are they doing that we're not doing that could make that difference.
Yeah,
that
is a good question. My guess would be that more shelter beds would probably be the answer to that. That because it seems that most people, if they don't want to be on the street, they want shelter, and we don't have enough shelter beds in our area to get people off the street and into shelter. So, the housing first model seems to show that people who are offered shelter or housing take it, they receive it and they accept it, and they then accept services later after being housed. But you have to have those shelter beds first to put them in.
So the second question has to do with, I assume that this program is open to anyone. They don't have to be a Yuba County resident, Sutter County. It's transient, could be potentially moving out, in and out. And of those 140 additional that are coming into the program, do you have any idea where they come from?
We do track some statistics on that. I can't report those to you right now because I don't run the coordinated entry system, so I don't know where they're coming from. We know that the majority of them say that they're from this area. So somewhere between 70 and 90% of the folks that go through coordinated entry say that within the last month or 2 months they lived in this area. So it's not like they just showed up here from San Francisco, for the most part, just showed up here from San Francisco or Arkansas and wherever and said, yeah, I'm going to come here and be homeless.
Is that a particular item that can be asked to really define what is this area?
Yeah, we recently changed that question. I know that coordinated entry recently started changing the way they ask that question. I mean, I'd be happy to look into it and see what the more recent statistics are in terms of what people are reporting. We're gathering a little bit more specific data about where people are coming from when they come to coordinated entry.
I think that's really valuable to know that information, to see if it's changing. Has it changed in the last year, 2 years, and where will it go moving forward? So just a point of interest. Any comment, questions from the public? Back to the board. I think there was a motion.
I'll second.
There was a first and a second. All in favor signify by saying aye.
Aye.
Aye. Opposed?
With the modifications that
I believe that was in that modification.
Yeah.
Yes. Very good.
Thank
Mark,
you.
thank you very much for, sorry taking up so much time, but really interesting points. So
No problem. Happy to do it. Thanks.
Thank you. Item number 238, 2022, approved professional services agreement with Wood Rogers Inc. for Plumas Lake Boulevard and SR 70 Interchange Project Phase 2.
Good morning, Board Chair and fellow supervisors. Sam Bunton, Assistant Director of Public Works. So a little background on this project. This is Phase 2 for the Plumas Lake Boulevard State Route 70 Interchange Project. This takes Phase 1, or the existing interchange there, and with 2 bridges and a new roadway, takes it over to the casino and sports and entertainment zone. So this also includes, or the agreement for the design of this includes the plan, specifications, estimate for the roadway, drainage, bridge, and traffic signal design, as well as includes coordination with utilities, Caltrans, and obtaining environmental permits and approvals as well. And to go about this, we competitively solicited or proposals from consultants. We got 3 qualified consultants that proposed. And then after this, through a qualifications-based evaluation process, and some cost and scope negotiations. We, at this point, recommend approval to you guys for an approval of the agreement with Wood Rogers for an amount of $2,235,000. And this also includes some optional tasks based on Caltrans coordination as well. Any questions from the board?
Questions from the board?
Through the chair, do we have an estimate of when the design is scheduled to be completed, assuming everything goes well?
Yeah, so if everything goes well, and this is based on coordination with not only the railroad, but Caltrans, as mentioned as well. We have given them a 2-year window that we are shooting for, assuming that coordination and everything goes as planned.
Okay, and during that 2-year, I assume we'll be looking for funding for the project. Is that correct?
Yeah, right now, that's one of the reasons we're pushing so hard is make us competitive for a lot of the grant funding that's coming down the pipeline.
Great, thank you.
Comments, questions from the public? Back to the board.
I'll second.
Have a first and a second. All in favor signify by saying aye.
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 Opposed? Thank you very much.
Thank you, appreciate it.
Ordinance and public hearings.
If you challenge in court the action or decision of the Yuba County Board of Supervisors regarding a zoning, planning, land use, or environmental protection matter made at any hearing described in this notice, you may be limited to raising only those issues you or someone else raised at such hearing or in written correspondence delivered to the Yuba County Board of Supervisors at or prior to such hearing. Public comments will be limited to 3 minutes per individual or group. First item is agenda number 210, 2022, Community Development and Services. This is a public hearing, hold public hearing and adopt resolution confirming diagram and assessments within the Gledhill Landscaping and Lighting District.
You're back.
Yep, it's CDSA heavy day today. Sam Bunton, Assistant Director of Public Works again. So on April 12th, a month ago on the board meeting, the board approved a resolution adopting the engineer's report and declaring an intention to levy and collect assessments within the district and establish that a public hearing be held today on May 10th in the Board of Supervisors chambers. So the assessment shown in the engineer's report provides revenue needed to operate the district for the upcoming fiscal year, which is 22-23. There has been no change in the assessment rate from last year's rate. And as of now, there are approximately 4,172 dwelling units that are assessed at $13.20 for the total revenue of $55,070.40 for the upcoming fiscal year. The county uses these funds to maintain landscaping, repair recreational equipment, improve existing irrigation, install new irrigation and landscaping, and other work needed to operate the district, which in this case is the Friendship and Fernwood Park site. There's a lot of names for Friendship Park. So at this point, we recommend the adoption of the attached resolution and confirming the diagram and assessments within the Gledhill Landscape and Lighting District.
I'll open the public hearing. Comments from the board? Comments from the public? I'll close the public hearing. Back to the board.
I'll second.
I have a first and a second. All in favor signify by saying aye. Aye. Opposed? None. Thank you.
Thank you. And hopefully it's not too late, but just to give you a heads up, we will be back next month to adopt the budget as well.
I expect you'll be back several times actually. So
yeah. Thank you. Appreciate
all right. Thanks. Rochelle, you were doing such a good job there. I like it.
The next item is going to be item 211, 2022, Community Development and Services. This is a public hearing, hold public hearing and adopt resolution determining and imposing assessments within the Linda Street Lighting Maintenance District.
Awesome. So not to be confused with Gledhill Landscape and Lighting District, this one is very similar. You'll notice that the maps are extremely similar as well. So just a little background on this. Today, since I missed it on the last one, we will be recommending and determining and imposing assessments, and we'll be back next month for another public hearing to adopt the budget. So a little background, Linda Street Lighting Maintenance District was formed in 1967 pursuant to Street and Highways Code. The district imposes annual assessments on each parcel of real property within the district based on estimated benefit to the parcel and a cumulative amount sufficient to cover the annual expense of maintenance and operation of an electrical street lighting system owned, maintained, and operated by PG&E. Streets and Highway Code requires lighting maintenance assessments to be levied pursuant to government code, and the government code authorizes the Board of Supervisors to determine the cost of the service annually, which the assessment offsets these costs. This government code section also authorizes the Board of Supervisors to determine and impose the assessment by ordinance or resolution. And so the proposed assessment for the upcoming fiscal year 22-23 is $12 a unit, which is the same as last fiscal year. There are approximately 4,000 units in this district, and with the $12 per unit assessment, this brings a total revenue of $48,000 for the fiscal year 22-23. And the county uses these funds to maintain and operate the streetlights. So today we recommend we hold a public hearing and adopt the attached resolution determining and imposing assessments within the Linda Street Lighting Maintenance District for fiscal year 22-23.
Very good. I'll open the public hearing. Comments from the board? Comments from the public?
Through the chair, just one quick comment. I believe this is the 6th time that this similar item has been brought before us since it's an annual item since I've been on the board. And I just want to note that out of all 6 of those times, I can't recall once staff saying that the assessment has been raised. So I know that's very unique in the time that we're in, and I just wanted to call that out. So anyway, I appreciate staff being as frugal as possible with tax dollars.
Not hearing any input from the public, I'll close the public hearing. Back to the board.
I'll second.
I have a first and a second. All in favor signify by saying aye.
Aye.
Aye. Opposed? Thank you.
Thank you.
Go for it, Rochelle.
Item 228, 2022, Sheriff Corners. This is an ordinance. Hold public hearing, waive first reading, and introduce ordinance adding new chapter 2.155, adopting a military equipment use policy to Title II administration of the Yuba County Ordinance Code.
Good morning, folks.
Good morning.
Since the adoption of Assembly Bill 481, it's required the Sheriff's Office to adopt a county ordinance to put in play to allow us to utilize what they are considered military equipment to provide services for our county. So since that adoption, we've formulated with the aid of County Council to draft the proposal that you guys have had for the county ordinance to allow us to continue to deploy and maintain the equipment in which we're using on a daily basis to provide for the community at hand right now. If there's any questions in regards to the proposal that you've had, it's rather lengthy. So rather than reading it, if you guys have had a chance to review it, any questions at hand, I'll be happy to have them.
Can you identify with your name and rank?
Yeah, Lieutenant Nathan Leibarger.
Thank you.
Through the chair. Do we have to use the word military? Because as you said, there are things like beanbag guns, drones, and rather less than lethal. I saw a lot in the description of the stuff. Why do we have to use the word military according to the new congressional requirement?
Yes. So unfortunately, that's the label of the Assembly Bill is the military equipment. So yes, we have to follow through with that, and Council's nodding their head as well. So
all right. With the exception of the machine guns, is anything there prohibited from civilian use?
Absolutely. There's quite a bit that's prohibited from civilian use. Our chemical agents that we deploy, diversionary devices, anything of that sort. Quite a bit of our equipment that we're deploying isn't allowed to be possessed by civilians, but it's things that we've had and tools we've utilized throughout many years.
When do you use the machine guns?
Well, we use semi-automatic and automatic.
The automatic, the M4s, I think is what it was.
Yes, we do have some M4s. So those are deployed with our SWAT team in a variety of capacities. Automatic weapons are only possessed by our tactical team in deployments. It depends on the terrain, the environment at hand, but it provides us superior firepower to those in the civilian capacities that they tend to possess. Unfortunately, we're not required to document that, so no, it's not in that list.
Is
Not yet. Let me open the public hearing.
I got a question.
Yes.
Is this surplus equipment that comes up for auction, or how does that work?
So some of it is surplus from the United States military, to include our Peacekeeper is documented in that, which is a commercialized chassis that has been fortified to provide ballistic protection. So that is obtained from government surplus. That is one item. The other major item that's obtained from that is our robot that we utilize and deploy. The rest of it is purchased throughout our funding.
Okay, thanks.
Questions, comments from the public? I'll close the public hearing. Back to the board.
So moved.
I'll second.
I have a first and a second. Signify by saying aye if you're in favor.
Aye.
Aye. Opposed? Thank you very much.
Thank you very much.
Correspondence. I see one letter.
One letter was received by the board from the California Faith Leaders regarding immigration customs enforcement contract with the Yuba County Jail.
Very good. Board and staff member reports. Andy.
About 500-600. It was really a well-attended event, and it was very, I think, effective for the kids, smiling and laughing, and they should be commended on that. Let's see, Golden State Financing went to that meeting, and they have a new loan program they're going to bring out, and I understand our county may take advantage of it, and it's really a good deal. You have to work at the county, buy in the county, and they'll finance it. And it seems we're the only one doing about 600 homes per year in the area. Tri-County Juvenile Hall is still stuck with, I think, the fire marshal as far as proceeding completely. Let's see, I also wanted to ask if we could have the recognition to be presented at the Marysville City Council, signed by all 5 members, so that we show our complete support for Marysville in this endeavor. If that's okay with the board.
So with acknowledgement from the board, is that fine?
Yeah. Yes.
I see 5 heads going, yes?
Okay.
Yes,
Yeah.
Sort of, there it was. Okay.
If I could, through the chair, I might need a little clarity for staff to be able to put that together as far as what we're recognizing the city for.
So I believe that is for Wes Finley as working with the city on coaching on behalf of the students in Yuba County.
District 2. All right, Highway 70 North, if you haven't been up there, that is full on. I mean, it's 5 lanes, and it is impressive. I mean, there's no holding back.
And then they get to Marysville.
Yes. So anyway, yeah, that I was actually shocked, and I hadn't been up there for about 10 days, and it's just, right up to people's houses. Also, Cedar Lane, I think we should see some people moving in maybe September, I think it's coming along pretty good. One other thing, I'd like to acknowledge all these departments that help put together these agendas. That's quite a onerous, I think onerous is the word, task. It's like publishing a novel every other week. I mean, we have between 300 and 700 pages. I don't know how they do it. Anyway, just acknowledging that. Thank you.
We have very creative people.
Seth?
Lots of stuff I'm trying to make happen in Olivehurst. We have some businesses coming in, and we're going to have a grocery store here any day, hopefully. Olive First Lane or Olive First Avenue has gone from a bunch of gas stations to now we have gas stations and a bunch of pharmacies. I think we're gonna have 4 pharmacies within a quarter-mile spot. So lots of new businesses coming in, very exciting there. Other things we're looking at in Olive First is outreach to seniors. So some of you may have seen that post and commented on it. So we're always looking for ways to improve the quality of life and build community.
Very good. Gary.
So just a report back from the 50th Cap to Cap that I was able to attend recently in Washington, D.C. Started the trip off with a SACOG tour of some redevelopment areas in Northern Virginia. It included former industrial and rail yard kind of areas that kind of have some nice, beautiful mixed-use development occurring on them now. And then also an older commercial corridor, maybe similar to like North Beale Road. We've got single-family homes back behind the commercial and, small kind of strip malls and gas stations along the corridor. We also saw where that's actually in progress of, it takes many years, but converting some of those commercial uses to, again, mixed use and still having the single family homes back behind there. So you have kind of a real walkable area with lots of housing, but also still having the commercial businesses there. So it was great to see. I participated on the flood team and attended meetings with staff from Senator Feinstein and Senator Padilla's offices where we talked where we requested funding for several projects here in Yuba County, including renewed authorization and complete funding for the Marysville Ring Levee project, and also a study related to the ARC spillway at New Bullard's Bar. We also met with FEMA, where we talked about risk rating 2.0 and the impacts on flood insurance rates in Plumas Lake and what can be done about getting those to be more accurate. So it was a very productive trip.
Any luck bringing back a blank check?
I did not have any luck with that, unfortunately.
Let's focus on that check. That'd be good. County Council.
Nothing. Thank you, Mr. Chair.
Kevin.
Just a quick comment. Really appreciated the board's engagement, the tobacco education item today, and then the Sutter Yuba behavioral health item. Specific to the Sutter Yuba behavioral health, that is an agency that's located or housed in Sutter County, but serves both counties. And I believe I heard a comment from Chairman Fletcher about staying active in that. And I think that's something I want to encourage as well. And if the board's okay with it, I'm going to send a little follow-up note to Mark, the presenter today, and thank him for coming in and engaging the board in the conversation and encourage that continued conversation.
Certainly worthwhile.
All right.
Lots of interest there, obviously.
Yep.
One of the items that I wanted to bring back to the board is I need a representative for the film festival that's trying to come to the Yuba-Sutter area. And there's a meeting, I believe, here in about a week and a half in Shasta. So is there any...
I'll volunteer.
I think I have a volunteer. Andy, if you'll step up, and Don.
I'm trying to work that out because I know a bunch of people up there. I was going to go up there anyway.
That'd be great. If the two of you will attend, let us know how that goes. That'd be wonderful.
I'm going to take our new video on water and Bullard's Bar up there and show them the tricky Yuba.
Tricky Yuba. I like it.
And I'm going to take Dee Dee Cordell's brand new bright red Mustang.
Sure you are.
Nice. I like it.
I think you're going to be left bleeding in the parking lot.
Rochelle, any comments? Thank you. And from here, we'll go into closed session, and there are 3 items that we'll be looking at.
Can we take a
5-minute break?
Thank you.
Always. Always.
Yuba-Sutter.live's local government live streams are presented by Plumas Lake Self-Storage in Plumas Lake, where lifelong local residents are helping other residents keep things safe, providing indoor storage units, outdoor RV and vehicle parking, moving supplies, and Penske truck rentals. Details at plumaslakeselfstorage.com.